Hello, my name is Scalercio. Today I'm going to be talking about the skeletal system. Here's a little flashcard with 4 bones that I have trouble remembering sometimes. Alright, so let's go ahead and start. So the skeletal system includes all 206 bones of the body, the cartilage, ligaments, and other connective tissues that stabilize and interconnect the skeleton. The skeletal system has many functions, including structural support for the body and all of its organ systems, protection for the delicate organ tissues that are inside of each of us, mineral storage, red blood cell production, leverage, and attachment sites for muscles and other organ structures. The bones of the skeletal system are organized into 2 divisions. These divisions are the axial skeleton and the appendicular skeleton. The axial skeleton consists of bones of the skull, the thorax, and the vertebral column. The appendicular skeleton consists of the bones of the upper and lower limbs, and the pectoral and pelvic girdles. Now, bones come in all sorts of shapes and sizes. However, there are 7 categories of bones based on their shapes. The first is sutural bones. These are small, flat, and oddly shaped bones found between the flat bones of the skull along the sutures. The next is pneumatized bones. These bones are hollow or contains numerous air pockets. An example of one of these could be the ethmoid bone in the skull. Next are the short bones. These bones are box-like in appearance, and a good example of one of these could be the carpal bones in the wrist. Next are irregular bones. These bones have complex irregular shapes, with some with short, flat, ridged, just irregular shaped. A good example of one of these could be the vertebral in the spine. Next are flat bones. Flats have compact bone surface that cover a layer of spongy bone. A good example of one of these bones could be the parietal bones on the side of your skull. Next we have the long bones. These bones are long and slender in shape. They can be found in the extremities, for example, the humerus bone in the upper arm. Lastly are the sesamoid bones. These are usually round, small, and flat in appearance. They can usually be found the joints such as the patella in the kneecap. Now I'm going to talk about the bones of the skull. Here's my skeleton. There are 22 bones in the skull. There are 14 in the face and 8 that make up the cranium. The face bones include the maxilla bones, right here. The palatine bone, open up in the mouth, right here behind the teeth. The nasal bones, right here, there's 2 of them. The inferior nasal concha, there's 2 of them, right here in the nasal sinus. The zygomatic bones, right here in the cheek, there's 2 of them. The lacrimal bones, these are in the eyes, right here, well, in the eye socket, there's 2 of them, 1 on each side. The vomer bone is right here also in the nasal sinus. You can't really see them in this model, but it would be right in here. And the mandible, which is 1 bone that comes across. It's like your jaw. The bones of the cranium include the occipital bone, so let's flip them around to the back. The occipital bone, right here in the back. The frontal bone, right here in the front. The parietal bones, there's 2 of them. They're right here on the sides. The temporal bones, the temples, like your temples in your head, right here. That's where we get it, right here on the side. There's 2 of them. The sphenoid and the ethmoid. So the sphenoid, you can see right here. Let's see here. This is supposed to be the sphenoid. It's kind of hard to see the suture lines, but this is where the sphenoid is. The ethmoid bone, you can see a little bit of it through the eye socket. They're right behind the lacrimal bone. It's 1 big bone that goes all the way across. All right. The bones of the axial skeleton, as we mentioned earlier, are the skull, the thorax, and the spinal column. Since we already talked about the skull, we're going to move on to the vertebra. Okay, there are 7 cervical vertebrae, 12 thoracic, and then 5 lumbar. The sacrum right here is made up of a bunch of different sacral vertebrae that are fused together. The coccyx is also made up of a couple of sacral vertebrae that have fused together also. The C1 right here, the cervical vertebra, is called the atlas. The C2 is the axis. Now let's move down to the thorax, and we can see the sternum. It's made up of 3 parts: the manubrium, the body, and the xiphoid process. There are 12 pairs of ribs also. 7 pairs of ribs attached directly to the sternum. 1, 2, 3, 4, 5, 6, 7. Okay? Pairs 8 through 10 are considered false ribs. The 1 through 7 are called true ribs because they directly attach to the sternums. 8 through 10 are considered false ribs because they don't directly attach to the sternum. And then pairs 11 and 12 are called floating ribs because they don't attach to the sternum in any way. Okay. Now we're going to move on to the appendicular skeleton. It's made up of the upper and the lower limbs, the pectoral girdle, and the pelvic girdle. Okay. So let's talk about let's go and start with the shoulder girdle, the pectoral girdle. So that includes the clavicles right here, or your collarbones. Then you have the scapulas. There's 2 of them. You have 1 each shoulder blades. You have the humerus. Then you have the radius. Radius is always, so this guy is standing in anatomical position. The radius is on your thumb side, so it's lateral. The ulna is the inner one, most inner bone of the forearm. Then you have the carpal bones of the wrist. You have the metacarpals. There's 5 of them. And then you have the phalanges. Then you have the proximal, middle, and distal phalanges. Those are your fingers. Okay, let's move on to the pelvic girdle. So here we have the pelvis, your hip bone. It's made up of 3 bones: the ilium, pubis, and the ischium. Okay, let's move on to the lower extremities. We have the femur. This is the largest, biggest bone in the body. It's a long bone, as you can tell. Then you have the tibia right here. This is the bigger bone of the lower leg. It also is the only bone that connects at the knee joint, which, speaking of which, we have the patella right there, your kneecap. Then the smaller bone of the lower leg is the fibula. Then we have the tarsal bones. These are the bones in the ankle. See if you can see the bones of the ankle. Then you have the metatarsals. See, these are these 5 right here, the metatarsals. And then you have the phalanges, which are the ends of the toes. Alrighty. So now, a good example of how knowing the skeletal system for my future career kind of applies to me, especially being a therapist already. It's important to know different bony landmarks, especially whenever you're palpating a patient, knowing what bone is where and what's what. Also knowing different types of injuries and how different diseases affect the bones of the body really helps with especially education and educating your patients on what parts of their bones are doing certain things, especially during exercises and stuff like that. That's how important knowing the skeletal system altogether could be for my future career. All right, that concludes my little presentation. Thank you very much.